It gives me great pleasure to introduce our speaker, Dr. Debara Tucci, Director of the National Institute on Deafness and Other Communication Disorders at the National Institutes of Health, a position she has held since September 2019. Prior to coming to NIH, Dr. Tucci was a longtime faculty member at Duke University in the Department of Head and Neck Surgery and Communication Sciences. Dr. Tucci's research has focused on understanding the biological effects of hearing loss in animal models and on treatment of otologic disease, including cochlear implantation. She partnered with the Duke Clinical Research Institute and colleagues at Duke to develop a national practice-based research network and led a research team that implemented and studied outcomes and cost benefit of adult hearing screening in primary care clinics at Duke. She has trained and mentored many resident physicians, junior faculty, and graduate students, both informally and through development of formal research training and mentoring programs. Current work as co-chair of the Lancet Commission on Global Hearing Loss allows her to pursue her passion for understanding and impacting hearing loss disability in diverse and underserved populations worldwide. So it is with great pleasure that I invite Dr. Tucci to speak to us on research perseverance, embracing change in a pandemic.
I'm very excited to talk about research perseverance. And in thinking about this, I think all research is perseverance. I think most of us, certainly myself included, have had the experience of having to really rethink our research programs and apply, send in multiple grant applications much of the time in order to really get our research program going. So I think that's kind of part of the way that it is. But particularly during this past year and a half, we've all faced tremendous challenges. And so I'm going to touch a little bit on that, embracing change in a pandemic and how things may be a little bit different going forward. Then I'm going to talk about research perseverance in the context of making all research in hearing and communication disorders available and accessible to all populations. I'll talk about our work to develop interesting, new, and innovative technologies that we hope will make treatments more accessible and affordable. And then last, I'll talk about how we want to move forward to make good on our promise of inclusive excellence, as we know that our science is better when we can involve those with diverse perspectives. And so one of the good things about working for the federal government is you hardly ever have financial disclosures, and I don't have any today. And I wanted to tell you, for those of you who are not real familiar with the NIDCD, just a little bit about our institute. So the NIDCD's mission is to improve the lives of millions of people with hearing loss and other communication disorders. And this spans the functions of hearing, balance, taste, smell, voice, speech, and language. This mission is mandated by Congress, and every year we prepare what's called a congressional justification document that details the work that we funded and the scientific advances and other accomplishments that have been achieved in our mission areas as charged by the Congress. Currently, we're in the process of developing a new NIDCD strategic plan that will be guided by our mission and our vision being advancing the science of communication to improve lives. You can see a little bit about our budget here. And in FY 2021, this past year, the NIDCD received a $7.5 million increase above our FY 2020 budget, bringing our enacted amount to a little under $500 million. That enables us to pay our R01-U01 pay line at the 14th percentile, which funds 14% of all of the applications that we receive. Funding by our mission areas is shown on the left. So a little bit over 50% of our funding goes to hearing-based research, followed by language, smell, and the rest of the areas, as you can see here. And this is not something that's predetermined, but really is just dependent on the applications that are received and the priority scores that are given to them. On the right is a breakdown of how the NIDCD spends our money, with the vast majority, of course, going to research project grants, 5% to career and training grants, a little under 10% to intramural research, and then other, which includes administrative cost, R&D, our small business grants, and other research. So I want to talk specifically now about the NIH response to the pandemic. In response to the pandemic, the NIH developed the 2021 NIH-wide strategic plan for COVID-19 research, and the priorities are shown here. First, to understand SARS-CoV-2 and COVID-19, including all aspects of disease progression, outcomes, and recovery. And so we have a major effort now to look at long COVID symptoms and recovery. The second goal is to improve detection by developing new assays, including rapid tests that can influence behavior, such as through asymptomatic testing. Third, to treat COVID-19 by developing new therapies or repurposing existing treatments and defining implementation strategies. The fourth, to prevent infection by developing vaccines and models of implementation. And one big aspect of vaccine development was to engage underserved and minority populations in clinical trials to test vaccine efficacy and safety in all populations. And then finally, to mitigate the threat of COVID-19, particularly in these vulnerable populations. So one of the major initiatives that were launched early in the pandemic is called the Rapid Acceleration of Diagnostics, or RADx program, which has several components, but today I'm going to focus on just one of them, which is RADx Radical, or RADx Rad, that the NIDCD played a major role in. This supports new non-traditional approaches to address gaps in COVID-19 testing. And for the NIDCD, the areas of particular interest were, first, to determine if chemosensory loss is an early indicator of COVID-19, if it's predictive of disease severity, disease persistence, or even other neurologic manifestations. And the second goal was to develop easy, accessible, and scalable chemosensory tests for COVID-19 that could be used in the home, in schools, large venues, and in under-resourced communities. So a competition was held, and we funded 4 awards at a total of almost $4 million. And the smell tests that were developed under this initiative are very simple. Most of them are peel and smell tests with odorants embedded on cards. This is similar to perfume ads in magazines, where you either peel or sniff or scratch and sniff. So we're awaiting the outcomes from those studies. We at the NIDCD, as well as across the NIH, have been very concerned not only about the direct impacts of the pandemic on health, but about the effects of the pandemic on the research enterprise. And this includes both the conduct of research and also the impact of the research stoppage or slowdown on career progression, especially for women and other vulnerable groups. In October of 2020, so about a year ago, the NIH conducted what was called the COVID-19 Impact on Extramural Research Survey, which aimed to gauge the impact of COVID-19 on the research community. This was responded to by over 45,000 researchers at domestic NIH-funded institutions, as well as 224 research leaders from those same institutions. And some of the results are shown here. Not surprisingly, the survey found that the majority of respondents perceived that the pandemic had impacted them significantly negatively. And some of the results included that 55% of the respondents said that they expected the pandemic will have a negative impact on their career trajectory. 68% said that societal and political events had negatively affected their mental health, and almost 80% reported lower levels of productivity. So the effects on mental health were substantial and really underline a lot of the impact of the pandemic. In response, the NIH has provided a number of new programs and flexibilities shown here at the bottom of this slide, as well as the next two slides. We have provided generous no-cost extensions and numerous modifications to existing grant protocols. We're now allowing preliminary data to be submitted post-submission. So once the application goes in the past, you were not able to update with any additional information, but now we are allowing that up to 30 days before review. And another significant response has been the allowance for childcare, which started last March for fellowship awards. And the NIH has recently announced that T awardees will also be eligible for this funding. So a bit more on the impact of the pandemic on research productivity, and the NIH response is shown here. And you can see that early and mid-career investigators have been particularly impacted. And the next slide will talk a little bit more about that. Some of the issues that have been called out as negatively impacting researchers' overall productivity are shown on the upper right. And this includes the reliance on virtual meetings with supervisors, trainees, and mentors. So we've gotten some very good experience with these online virtual platforms, and they're great for many things and may even open up some new opportunities. But we're really missing that interpersonal interaction and personal touch. As we all know, all of the in-person national meetings, regional meetings, and certainly the international conferences have been canceled, and this has impacted a lot of people in a negative way. And certainly the changes in access to laboratory and animal facilities has been a major issue. So the NIH, again, has taken a number of measures to support the research community, including delaying the start dates of some awards to accommodate these lab closures, permitting the continued payment of salaries on research grants, despite the fact that the laboratory work could not be conducted. And for those in clinical work, those clinical responsibilities have definitely increased during the pandemic. We've encouraged grantees to shift research focus, such as obtaining supplements to do work that's relevant to the pandemic, or to convert in-person activities to virtual when that's appropriate, to focus on the safe conduct of research. So we recognize that there's been a real special challenge for early career investigators. The diagram to the left depicts some of these, again, that early career investigators are the ones who are usually in the stage where they're starting families, they have young children at home, many, many personal challenges that are compounded then by the need to continue to work. And so this is a lot to balance. And I found the figure on the right in a publication that I thought really summed up pretty nicely what we're all going through. And that's that early in the pandemic, we're having to react to a whole new reality that's associated with a lot of grief and loss of the way that we used to do things, anxiety about how to manage on a day-to-day basis and what the future holds, and perhaps some guilt about being split in at least two directions, if not many more. So some of the specific challenges included the required pivot from research and protected time to the clinical activities, lab closures, conversion to virtual platforms, concerns about career progression and tenure clock concerns, financial concerns, and then, as I mentioned, those added burdens of childcare and other new and additional responsibilities and worries, including caring for aged parents. And then as we progress through the pandemic, we've had to adapt and prepare new strategies for dealing with all of this, including new support structures at home and at work, modifications in our research, new ways of networking with colleagues have been really important, and virtual talks. And so some of the new ways of doing things have actually been a bit better. So I read, for example, about a program that was started in one of the Harvard hospitals of having a compilation of early career women investigators who would make themselves available to give virtual talks in other institutions, and then set it up like a grand rounds with associated personal conversations via Zoom after the talk was delivered. So this is just one example of something that would be good to continue even after the pandemic, because oftentimes early career investigators find it difficult to travel to meetings. So this may provide a new opportunity. So the NIH response has been to extend the eligibility period of some early career applicants. I've learned from Mike Lauer that the early career investigator extensions have doubled from about 500 to 1,000 in the last year. The NIDCD specifically has allowed early career scientists whose careers have been significantly impacted by the pandemic to request grant extensions. And this has applied to F and K mechanisms, and also the early career research grantees, which is a special R21 program provided by the NIDCD. So I'm going to switch gears now and tell you a little bit about selected programs in the NIDCD research portfolio that I think are exciting and will be of interest to you. And the first thing that I wanted to talk about is making the care that we provide for those with disorders in our mission areas more accessible and affordable. And I'll start with hearing health care. So we all know that unaddressed hearing loss has significant public health consequences, and some of those are shown to the left of this figure. The Lancet Commission on Dementia indicated that hearing loss is the major modifiable risk factor for dementia, and other findings include a higher rate of hospitalization, higher rate of healthcare costs, and a higher risk of depression and anxiety. The NIDCD has been very interested in funding research that reduces costs and increases accessibility of hearing healthcare for adults. So we know that some of the barriers to hearing healthcare include the high cost of hearing aids, complexity and difficulty in accessing hearing health services, lack of insurance coverage, and also stigma associated with hearing loss. And we know that of adults who could benefit from the use of hearing aids, only about 20% on average use them. The NIDCD was a sponsor of the National Academy study on this topic, which recommended that hearing aids be sold over the counter rather than just by prescription by audiologists and hearing aid dispensers. And that prompted legislation that was passed by Congress in 2017, supported by Senators Warren and Grassley. And we were very, very pleased to see that this month, the Food and Drug Administration published the draft rule for creating a new class of over-the-counter hearing aids for adults with perceived mild to moderate hearing loss. So I'm very happy to highlight again, as Dr. Gross mentioned at the beginning, one of the studies with Crystal Riska as the PI and Hannah Sieber as the consortium PI for the UNC application studying falls-related injuries and hearing loss. And he's already described this a bit, but looking at whether amplification modifies the odds of suffering a falls-related injury in older adults with hearing loss. So very interested in seeing the outcome of this study. This is a study conducted in Arizona by Nicole Maroney as the PI with her colleagues there. And the program is called Oyendo Bien. It was developed as a pilot study, and Oyendo Bien means hearing wellness. And so this was conducted in rural Arizona. So one of the aspects of the study was to look at the availability of hearing healthcare services in the state. And the map on the left shows very well the mismatch between hearing healthcare providers, in this case, audiologists and hearing instrument specialists, shown by the dots, and the state population, shown by the intensity of the color coding. So you can see that there's a significant mismatch. The clusters of dots that you see are Phoenix and Tucson. And you can also see that outlying areas of the state have very few audiologists. Their analysis showed that people may travel up to 100 miles to see an audiologist, and that there are 6 metro counties in Arizona with no audiologists whatsoever. So the team chose Santa Cruz County, which is on the Mexican border, for their study. And they developed this intervention with the aid of the community. So this is community-based participatory research, which is a theme of a lot of our health disparities research programs. And this program is comprised of a 5-week Spanish language, culturally relevant hearing health outreach program for older adults with hearing loss, facilitated by community health workers, which is another theme of many of these programs, and supervised by an audiologist. The post-program focus groups revealed increased self-efficacy and decreased stigma as a result of the program, and the results 1 year after the program showed that it was effective, in that most participants sought some form of hearing-related health care. And I'd like to tell you about another program with some similar themes, but in a much different kind of setting. So this is a program that was conducted in inner city Baltimore. And we see the graph on the right, which shows data from the NHANES database, showing that disparities in hearing aid use between white, Black, and Mexican American adults age 70 and over is quite stark. So hearing aids were used by only 20% of white adults who need them, but the percentage of those using hearing aids drops by half in Black and Mexican American populations. And so this program was developed to provide a basic level of hearing health care to at-risk, urban dwelling, low income, and primarily minority minority older adults through, again, community-based participatory research consisting of a hearing screening process, rehabilitation counseling, and then amplification device training. This program is headed by Frank Lin and Carrie Neiman. The initial grant period has ended, but they have a continuing award to continue the work. And Carrie Neiman was actually awarded a 2020 National Academy of Medicine's Healthy Longevity Catalyst Award for this program. I'll now switch gears to talk a little bit about a program that focuses on communication disorders in children. Among the studies that we fund to reduce healthcare disparities, this is an important program that really addresses the follow-up after newborn hearing screening. So the PI here is Matt Bush, who's a neurologist at the University of Kentucky. And this program, the CHIRP Navigator trial, is aimed at increasing follow-up for children who fail newborn hearing screening in the rural Appalachia region of Kentucky. And so as background, as some of you know, about 2 to 3 out of every 1,000 children in the US is born with a detectable level of hearing loss in one or both ears, so fails newborn hearing screening. Universal newborn hearing screening is mandated by law and carried out with great efficiency in the US. So about 98% of newborns are screened, but unfortunately, about 36% of those children screened are lost to follow-up. And so this program is addressing that by studying whether the use of a patient navigator who gives personalized attention and tries to address the reasons for lack of follow-up with parents is a good way to address that problem. And as an additional point, I wanted to call your attention to the left side of the slide, which shows predictors of infant hearing loss. So it lists factors such as gestational age and birth weight, but of all of these, minority race is the greatest risk factor for hearing loss in infants. And so addressing this in a minority population should be very effective. One example of research that studies speech and language development in children is this study looking at development of speech and language in children with cerebral palsy. So about 60% of children with cerebral palsy have some type of communication disorder, including dysarthria, which can greatly impact the ability to understand the child's speech. Despite this, we have really very few studies exploring communication in cerebral palsy, so this grant is fairly unique. There is a lot of heterogeneity and communication ability among children with cerebral palsy. An example of this is shown in these graphs on the right. So the top panel shows the intelligibility of typically developing children, both by intra and inter-rater variability, and you can see the variance is tightly clustered. And contrast that with the bottom two panels that show a large variation in speech intelligibility in children with the kinds of speech motor impairment seen in cerebral palsy. So this is a longitudinal study that will collect data over 15 years that we hope will result in models and trajectories of speech and language development in cerebral palsy that can be used to predict outcomes, test interventions, and guide treatment decisions. The NIDCD participates in the INCLUDE project, which was launched in June of 2018. And INCLUDE stands for Investigation of Co-occurring Conditions Under the Lifespan to Understand Down Syndrome. So we know that obstructive sleep apnea is not at all uncommon in children with Down syndrome. In most cases for adults, we prescribe CPAP or continuous positive airway pressure or a sleep mask as a treatment. As you might expect, this is not very well tolerated in children with Down syndrome. So another way to treat sleep apnea is with the surgical implantation, as shown here, of the hypoglossal nerve stimulator. And this is something that now we're studying in children with Down syndrome. So the hypoglossal nerve enables tongue movement, and that's the mechanism by which this is thought to be effective. So a phase 1 trial was conducted, and this had an interesting and unexpected finding in that parents reported that their children were more attentive and doing better in school with this treatment. So the study has now moved on to a phase 2-3 multi-center trial. The primary outcomes are 5 neurocognitive measures that are collected pre-implant and then at 6 months post-operatively. And they include assessments of brief attention, sustained attention, processing speed, verbal intelligence, and executive functioning. The 2 primary outcomes will be a measure of the diversity of vocabulary and a measure of syntactic complexity. So that's another exciting study from our investigators. So I'm going to switch gears again now and tell you a little bit about some exciting new technologies that are being investigated as part of the NIDCD portfolio. So back to hearing loss again. We know that up to 30 million Americans with hearing loss could potentially benefit from hearing aids, but a minority use them. And so I talked a little bit earlier in the talk about cost being a barrier, and that is why over-the-counter hearing aids are so exciting because they will be less costly and more accessible. But actually, when you look at the data about cost, you have to consider that in Europe, where hearing aids are free of charge, the use is not much greater. It says here 25%, I've heard as high as 40%, but in any case, cost is not the whole story. And so one of the factors that I think we need to consider is the perception that hearing aids don't work well in many situations. And I've heard this from patients before, where I've talked to them about hearing aids and they say, well, you know, I may consider that, but I know so-and-so who got hearing aids that are in the drawer and they never use them because they say they don't work well. So one of the things I wanted to tell you about is some exciting work that's being done in technologies to improve speech understanding, particularly in noise. So I'm going to tell you about two different strategies that have been implemented. This is the first one, and it deals with the cocktail party problem. So a standard complaint from hearing aid users relates to the difficulty of understanding speech in the presence of background noise, and this is particularly a problem when there are multiple talkers. And attempts to address these challenges with current technologies and speech processing strategies have really not yielded significant improvements over the past many years. And so one of the examples of that is that inexpensive over-the-counter hearing devices often perform as well as high-cost hearing aids in several studies that have been done. So the work here is work by DeLang Wang and colleagues, and this group has applied machine learning algorithms based on deep neural networks to segregate sounds in order to isolate and amplify the desired speech sound. So the neural network, as shown here on the left, is trained on a speech, not speech dichotomy, and can further learn by adjusting the feature extraction elements within the program. The separation into speech and non-speech streams is shown up here on the left, so speech and non-speech. And once identified, the desired speech signal is directly amplified, as shown here. So refinements have led to the first demonstration of a monaural or single ear technique that successfully improves speech reception and noise for hearing impaired listeners. And the data are shown here on the right side of the slides so there's an improvement in speech understanding shown by the crosshatch bar in normal hearing subjects, but the real benefit is in hearing impaired subjects. So I'm going to do a little demo here. The first is to show the mixed signal that one might hear in a cocktail party.
Bring your best compass to the third class.
And then if we implement this machine learning algorithm, which is called Deep Casa, you can now pick out the individual speech signals.
Bring your best compass to the third class.
The mute muffled the high tones of the horn.
So that's a very exciting result. This is another concept, and this is based on being able to use cortical representations of speech and auditory attention to identify important or attended signals. So this is based on work by Jonathan Simon, and he and his team use magnetoencephalography recordings to investigate how a complex acoustic scene consisting of multiple speech sources is represented in the hierarchical stages of the auditory cortex. And they found that in primary-like areas of the auditory cortex, the entire auditory scene is represented, including both signals that are attended and those that are ignored. But in higher order auditory cortical areas, the attended stream is actually represented separately and with higher fidelity than the unattended streams. And this is shown in the left side of the figure, where the dark blue is the attended sound source, and the neural signal measured from the cortex is shown in black. So there's a close correlation there. And beneath that is the unattended signal in the light blue, and the correlation with the signal measured from the cortex is not as good. So whereas the smart hearing aid described in the previous slide would pick out just one speaker in a variety of backgrounds, the results of Simon's research give rise to the idea that the brain activity itself could provide a signal that indicates which voice at the cocktail party is of interest. So this work was taken further by Nima Meskarani, who's on faculty at Columbia, and he proposed the possibility of a brain-controlled assistive hearing device that can monitor the brain waves of a listener and compare this with sound sources in the environment to identify the most likely source of the attended speech. And then the device can selectively amplify the attended speaker relative to the others in the crowd. And I'm going to now go to this slide, and you'll hear a demonstration of this, where the speaker, a male and female speaker, are combined in the beginning, and then the algorithm focuses first on the male speaker and then second on the female speaker.
How to take care of a dog. Dogs are great companions for a variety of people.
Especially when you know how to do it.
Have you ever thought about having your own
Shepherds
companion?
can be found all over the world.
If you do not have a dog yet,
Any
you
place
need to
from
understand the
deserts of
difference
Israel
between
to
breeds
the
before
highlands
making
of
a choice.
Scotland.
The breed of a
Find a good
dog
place
can
to
have
live.
significant impact on its
Many shepherds
personality,
like to live in
as
mountains.
well as its size,
If you want
health,
to do this,
and
it
required
would be best
maintenance.
to move to Wales or
For example,
Scotland. If you
long-haired
want to
breeds,
live in the United
like
States,
collies,
move
may
to
be
Idaho
useful,
or
but they
Wyoming.
require frequent
Buy
brushing.
a sheepdog.
If you do not have time
Some
to devote to
sheepdogs are better
weekly
than
or
others.
even daily maintenance,
You would do
you
best
may
to
need
look.
Okay, so I think that was a good demonstration. So some of the concepts shown in that last demonstration began with the work of Eddie Chang at UCSF, as Nima Meskarani trained in his lab. So Eddie Chang is now the chair of neurosurgery at UCSF. He's an epilepsy surgeon, and epilepsy patients have been the focus and the vehicle for much of his work. His work is funded by NIDCD, the NINDS, the Neurology Institute, and also the Brain Initiative. And this is focused on alternative communication devices that can help those with neurologic disorders such as advanced ALS, a stroke, and other disorders that compromise speech ability. And the work takes advantage of brain-computer interfaces, which are technologies that can directly read out brain signals to replace the lost function. Since imagined speech or thoughts don't generate, using current technology, sufficient brain activity for decoding, this activity is measured from over the speech cortex. And so a proof of concept study was performed by using high density electrocorticography signals analyzed using a neural decoder that first analyzes activity into articulatory movement and then transforms these representation into speech acoustics to generate synthesized speech. So I'll play one last demonstration.
Shipbuilding is a most fascinating process.
Shipbuilding is a most fascinating process.
The proof that you are seeking is not available in books.
The proof that you are seeking is not available in books.
Shipbuilding.
So that's pretty exciting, I think, because it is intelligible. And so further refinements hopefully will bring that work around or along. And he has many ideas for how to expand the work in the future. I think I am a little bit short on time, so I am not going to go over this in as much detail, but this is another concept for improving vocal production in people who have severe speech impediments or people with ALS, such as in the last example, by generating synthetic speech using the speech of the individual as well as a donor speaker. So that's a promising technology. We're, of course, very interested in cochlear implantation. This is a very successful technology, but also a very expensive one. So it's estimated that as many as 25 people worldwide could benefit from cochlear implantation, with half of this number in India and China alone. But a very, very small minority actually receive the cochlear implant, primarily because of cost issues. And so one thing that we're looking at the NIDCD is whether thin film electrodes, which can be machine made in many different venues around the world, rather than in just a select few, might really democratize this technology. And so the cochlear implant, the conventional implant on the left, is something that's made by hand in very few facilities around the world. But microfabrication, shown on the right, can provide the opportunity to fabricate implants using thin film technology that can be machine made and potentially offer much more in the way of flexibilities than the current technologies permit. And so now, finally, I'm going to talk about inclusive excellence and some of the efforts of the NIH and the NIDCD. So the NIH as a whole is very, very strongly committed to both maintaining a work environment that is inclusive and free of discrimination and harassment, and also being a leader in our scientific workforce efforts to include diverse perspectives. So one major NIH-wide effort is the UNITE effort, which is something that all institutes participate in, and we're looking forward to implementing many of the suggestions of the UNITE initiative that have to do with our extramural workforce, our intramural workforce, our staff, and various implementation strategies. And then within the NIDCD, we also have a number of initiatives. For example, last year I charged a advisory council working group on diversity and inclusiveness. They made several recommendations that we're very excited about implementing. And we also have our own internal diversity working group and implementation group. Hopefully, after the first of the year, we're going to be recruiting a chief diversity officer who will help us with implementing many of the new initiatives that we would like to proceed with. The NIDCD recognizes that for us to remain a global leader in scientific discovery and innovation, we're dependent upon a pool of highly talented scientists from diverse backgrounds. And these are just two of the initiatives that I'll talk about today. The first is a trans NIH program, which is the F31 Diversity Fellowship Program. And that's intended to increase the number of scientists from diverse groups. And then the second program that we have is the Diversity Supplement. So this is a supplement awarded to established investigators who are interested in training a diverse workforce. And that's a very successful program. Earlier this year, we introduced a number of initiatives using the R25 mechanism, and the two that are diversity focused are shown here. So these are meant to be programs that involve more than one institution. It may involve a high resource institution and a low resource institution in a partnership. It could be a regional or a national program. The first is to support mentoring networks to enhance diversity. This also has the advantage of creating a cohort, which we think is very important to have those shared experiences and be able to develop diverse cohorts in our academic programs. And then the second is to develop a program for research experiences to train a diverse workforce. So a webinar is planned for the next couple of months where our training officer, Dr. Alberto Rivera Rentas, will provide more information and answer questions about these programs. And in the meantime, I encourage you to reach out to him if you have questions. The NIDCD has a number of career development awards to support investigators, and a couple of them are shown here. First is the KO8 program, and this is intended to support individuals with a clinical and health professional doctorate who are interested in supervised career development experiences in basic research. And the second is the K23, which is intended to support similar group of individuals in supervised career development experiences in research conducted with human subjects. And I wanted to show you a little bit of information here. So I wanted to talk about perseverance and show here some encouraging data on gender differences in K award funding. This was obtained, data were obtained from a 4-year period from 2016 through 2020. And it shows the percentage of female awardees and male awardees. So female awardees are shown in light blue, and the orange bars show the male awardees. And in all but the K08, you can see a majority or near equity in funding of female applicants for these programs. Particularly striking is the high percentage of female awardees for the K18 mechanism. The purpose of this award, which is called Research Career Enhancement Award for established investigators, is to enable established proven investigators to augment or redirect their research programs through the acquisition of new research skills to answer questions relevant to our mission areas. And this award provides 6 months to 2 years of advanced mentored research, career development, and requires a commitment of 25 to 50% professional effort. So I think these are very encouraging statistics, and we're excited about the future development of all of these programs. And then finally, I wanted to talk a little bit about our increased focus on development of programs and strategies to engage underrepresented minority populations in clinical research that can be of benefit to these populations. So one example of the importance of the recent clinical trials regulations is to establish safety and efficacy of the COVID-19 vaccines. And so the NIH worked hard to develop strategies to enroll underrepresented and minority populations in these studies. The NIDCD looks to increase the clinical use and public health impact of NIDCD-supported clinical trials through the design and implementation of recruitment strategies for involving underrepresented minority participants. So this is an increasing focus of our clinical trials engagement. In addition to stating the demographic breakdown of the geographic area in which the science will be conducted to determine inclusion enrollment by race and ethnicity, a recruitment plan is now required for all clinical trials. So I hope that this overview was helpful. I would really welcome any of your comments. I'm sorry that the time is short. I tried to get through as quickly as I could, and I am going to stop sharing now. All right.
Thank you, Dr. Tucci, very much. We have only a few minutes for questions. I'm going to hand over to Dr. Riska and Dr. Seibert to ask any questions that came up in the chat.
Can you hear me? I am here, but can't see any of the buttons on the bottom. So I can't read the chat. I apologize.
Okay. Well, I'll read. Dr. Williams asks, one challenge in our discipline relates to the small and non-diverse pipeline of individuals seeking a PhD in communication sciences and disorders and other areas that align with NIDCD's areas of funding. Is this a concern at NIDCD? And if so, how is it currently being addressed?
Yes, so I think some of the information that I presented towards the end is applicable for this, but we are considering other programs such as having established investigators bring in high school students and undergraduate students who can then be exposed to the research in our mission areas. So it is something that we're concerned about. There's some wider NIH programs for neuroscience in general. We have participated in some of those in the past, but in general, we prefer programs that are really more specifically targeted to to people working in our mission areas. And so we are trying to develop some strategies for this. Welcome any thoughts you have.
Thank you. Again, enter your questions in the chat so we can see them. I have a question. You did not touch on this, but what is the interest of the NIDCD in international collaborations through perhaps the Fogarty International Center?
Well, that's certainly an interest of mine. So that's primarily what my extramural activity is working as co-chair of the Lancet Commission on Hearing Loss, and we're developing a series of recommendations. I have presented to the Advisory Council for the Fogarty Institute, and they're very interested in collaborations as well. Many of the other institutes do support a number of collaborative projects between US and investigators outside of the US. So I would personally be extremely interested in seeing more applications that involve global partners.
Thank you. Are there any other questions? I know that Dr. Tucci is on a bit of a tight time schedule here. I don't see any other questions, so we'll bring this to a close. Thank you so much for that very expansive presentation. And as I just note, we have recorded this, so anyone who wants to catch up on details that they missed as we went through, that recording will be made available. So again, thank you to Dr. Tucci and her team, and also to Patty Kinnear at this end and her team, who've been working diligently in the background to keep the logistics of this flowing. So thank you to everyone.
Thank you. Bye-bye.